Today on Talking Solutions, we've got Chef Sharynne in-house now. Of course, I know you from working with Kate on KDWN 720, which is our news talk station down the hall with Beasley Media Group. We share a lot of interesting thoughts.
Yes. Lifestyles and foods and health.
I love people like you. Today we have several things that I know that we want to bring to light. Flavors of the Heart with the American Heart Association, which we'll get into. But I know that you also have other interests related to heart health. And I know that you're involved with the American Heart Association here in Las Vegas. What is your role with them?
I started off with the American Heart Association 6 years ago as a volunteering chef, which I still continue to do up until last year. And then I'm getting older. Got to be a little too much. But as a participating chef, I'm a raw food chef, professionally trained. And I go back about 13 years when there was no raw food in Las Vegas and people would just turn up their nose and run the other way. So I thought, the American heart and raw food, good for the heart, good for the body. Let me see if I can get in and become a participant. They didn't even have anybody in that category at that time. Raw food, what is that?
They're that's salad, right?
Exactly. And I'm saying, no, that's not it. So that's how I started. I did chefing every year. And then in my fourth year, because I love public speaking, I decided that I wanted to do more and get more out into the community and to allow the American Heart Association to open up those doors for me. Because as a raw food chef and even as an educator and a nutritionist, sometimes it's difficult to get those doors open. I'm not a shy person, so it's usually not a problem for me, but there's just some roadblocks that were in the way. So the American Heart Association became a wonderful tool for me to not only learn about the organization, but to use the organization as my platform also to put together a package about heart healthy. And it starts with your food and teaching them about eating healthy food and how to prepare raw, healthy, simple, delicious food. So that's how it started. And then at my third year, they had asked me would I like to do this and do that. And I did studies inside the Clark County School District. And we'll talk about that. That's how Teens Cook with Heart got in the Clark County School District, was a result of that work that was done 3 or 4 years ago. So anyway, I was asked by our director, Annarella Jordan, if I would like to become brand ambassador for the American Heart Association as their spokesperson, not only about American Heart, but just about the body and teaching and learning and cooking and raw and all of that. It just has blossomed. I mean, I've been able to reach a lot of people through the American Heart Association. It's been wonderful.
Just a few days ago, they said, once again, number one killer with Americans is heart disease. So it's obviously a topic of enormous concern.
Certainly. My mother suffered from hypertension or high blood pressure. African American, it's like our number one killer. And I saw her go through as a child, pill after pill after pill and blood pressure and this and that, to a point where over a period of time, those medications became so toxic for her that they ruined her kidneys. They put her into kidney failure from a toxic buildup of all the chemicals.
So that leads to a renal type failure?
Absolutely. And that changed my life because I, being a AMA certified surgical tech and a lab technologist and histologist and all these other things, had been following the protocol, take your medication, did everything they told her to do, and she was dead.
The traditional guidelines didn't help this time.
No. And if we start to become more honest with each other, we will find out that traditional guidelines in most of what we are doing is wrong. Don't eat this. It's not good for you. But 6 months later, it's okay. This is not good for you. No, it's okay.
A new study comes out
every
directly
day.
To the opposite of what you heard a week before.
Let me just explain a little bit about studies. Peer-reviewed sciences are kind of good, but they too have a financial component to them. So you really have to use your own body as a judge. I've had people who have been diabetic, and they can't seem to get their diabetes under control. They've tried this, they've tried that. The doctors had them on this one and that one and this one. I said, gosh, did you ever think about your diet? That can't be because the doctors would have told me that. No, he wouldn't tell you that. He's not trained in nutrition.
Doctors don't get a lot of training in that area.
And I'm not against doctors. I'm not against anything like that. I came from that community. But doctors are trained in something that's called allopathic medicine. Basically takes the body and dissects it into parts like a machine. Your shoulder hurts, let me give you something for that. You got a knee ache, let me give you, your hip. Okay, so we're prescribing all these things because we are taking care of the problem that you presented, and that is what? Pain. We will try to keep you comfortable. We will manage your disease. We cannot cure it because we're not capable of curing. We were not trained in how to cure. Naturopathic doctors, holistic doctors will cure because they go to the root of the problem. What is causing that knee, that hip, that headache, that wrist, that clicking, eczema on your elbows, the calculus on your heels. That is a sign of something. If you have like cracked heels all the time and you're always having problems with pedicures, cracked heels are essential fatty acid deficiency.
It's a symptom.
So if you're going to the doctor for maintenance and for pain, they will be able to help you. But I've not met anyone yet that has gone to a doctor and been cured. And again, I'm not bashing doctors. They have their place. If I have a gunshot wound, if I need a pin set, open heart surgery, that's great. But I'm eating crap, French fries, yogurt, pies and cookies and chocolate. And then you go, oh, I don't feel good. I don't know why. Well, how's your diet? Well, I don't eat that. Really? You don't eat any of those things. And if that's the case, you should not be sitting in here right now talking to me.
Food is medicine. I've always believed that.
It is, but it also becomes a lie. When we had our restaurant all the time. Well, how's your diet? Well, my diet's fine. Well, then if it was fine, you wouldn't be complaining. You tell on yourself.
It makes a huge difference what you consume, what you eat.
I've learned, Terry, over the years that no matter how badly we abuse our body through proper nutrition, supplementation, exercise, whether it be mental, spiritual, the body has the innate ability to heal itself. You don't have to tell it. If you cut your finger, do you have to tell your body, okay, now stop bleeding and I want you to start clotting? You don't have to tell it anything. It knows what to do.
Of
but
course.
If you do not give it the raw materials that it needs in order to do that, then you've created a whole nother scenario of problems. And that's where most of us are today. We've robbed our nutritional gas tanks. There's nothing left. So the signs and the symptoms and the pains and the aches and the boils and the cysts and the tumors, these are all signs something is wrong internally. I don't buy in much to genetics, and I'll tell you why. We have been sold a story about genetics. In some cases, yes, there are defective genes that can be passed along. But in most cases, in my experience of over 40 plus years of medical experience, my experience has shown that it's more of a familial trait than it is a genetic defect.
It's more our habits.
Exactly. And how do we learn habits? We pass them on from generation to generation. So if grandma has breast cancer and mom has breast cancer, you're the daughter, there's a damn good chance you're going to have it too. And there's another damn good chance that if you have a daughter, she will too, because why? You all have trained each other. And the problem with diseases is that it's very easy, particularly in the cancer family, to assimilate the disease. It's called epigenetics, which means it's above our genes. We've been told we can't do anything because our genes are predetermined.
Sure, it's in my DNA.
Exactly. There's nothing I can do. That's not really true, because they have studied and they have shown identical twins raised in the same family, born from the same egg, same sperm, the whole 9 yards. Still, when you look at identical twins, look at them carefully. One of them is usually more attractive. One of them is usually a little brighter. One of them is a little more outgoing. And the other twin is the lesser twin, the weaker twin, the twin that's more sickly, the twin who doesn't age as well. And this comes from the expression when you're growing up. As a child, you feel this. Oh, mom loves her more than she loves me. That's because she's pretty, or that's because he's more athletic, okay? We buy into all of that, and those expressions we accept, and it becomes part of our own DNA.
It manifests itself.
It does. It manifests itself. So now we become exactly what we say we are. That's why we try to tell people, do not identify with your disease. I'm diabetic. No, you're not. You're none of those things. Don't identify those things. Don't make them a part of you, because research has shown when people are diagnosed with cancer and the doctor says, Terry, you only have 6 months to live, more than 80% of those people will die within that period of time.
You just accept it.
You do. Because after all, the doctor knows best. He knows more than you do. He is trained. Wrong. Don't accept it. Think about how you got there in the first place. My favorite topic is cancer, because my husband is a bladder cancer survivor now for going on 10 years. No chemo, no radiation, no surgery. We did dietary changes, high antioxidants and different types of brown seaweed. So if an 80-year-old can do it, but it's all about whether or not you want to do it. It's up to you.
Chef Sharynne is with us. We will be talking about flavors of the heart in a few moments. We started out, though, talking about involvement with the American Heart Association. You've been involved with them very very deeply. As a raw chef, you live a vegan lifestyle. You said that your mom had passed related to hypertension, heart issues. What made you go there?
I think just her death. It shocked me because here I am, someone in the profession, and I watched a very close loved one, my mother, who did everything that she was told to do. She took her pills when she was supposed to. It's 10 o'clock and I have to wait a half hour before I can take another one. And she went through all of that, and yet still it took her life. And my mother died young. She was only in her 70s, only a few years older than where I am right now. So it took me on a path. It was a shock for me because I've been in the medical industry. This is how I was trained. This is what I learned. This is what I know. And to see it fail me personally, it did a number on my head. The day she passed away, I was overweight, 203 pounds. My husband had issues. He had sciatic nerve. They wanted to do surgery. We just woke up and said, you know what? We've got to find a better way.
So what steps did you take? Certainly nutrition had to be a huge part of it. I know that you have your involvement with the American Heart Association, but I've also heard you talk many times about the importance of oral health, your gums, your teeth, and the relationship to your heart.
That's how I started. It's really been an evolution for me, as you can tell, starting off with, the death of my mom, motivating me to get in better shape, to get my husband and I under control, and then to start wanting to spread the word because it made us feel good and we got healthy. We now want to help the community. The American Heart Association came in. Then they allowed me to become an ambassador. It allowed me to continue more and more to reach further out into the community, to really make a difference in people's lives.
And share the knowledge.
Absolutely. Absolutely.
That's what it's all about.
I think I was never designed to be a mom. Instead of that, I was still given the ability and the gift to be able to teach, instruct, nurture people, and then empower. And that's what a mom does. So the world are my children, as far as I'm concerned, because I've been given this gift, and this gift is to spread my knowledge and to help people. The correlation, as I started reading more and more, I'm a periodontal sufferer and have been for 45 years. I was never diagnosed until I was 24 or 25 years old. I woke up one day and I had this huge swollen side of my mouth and I didn't know what was going on. I had followed all the recommendations, floss and brush your teeth twice a day, and I did all of that, but it wasn't enough. So I went to the dentist and I found out that I had an abscess at the base of the root of the tooth. I didn't know at that point. Once you reach the abscess stage of gum disease or periodontal disease, you're in stage 4. I was horrified. I was shocked. I was in denial. All the things that you would go through when you get any type of a diagnosis. And I'm like, well, what does that mean? Stage 4 means you're going to lose all your teeth because it's a degenerative disease. So as I started studying and learning more and more, I started finding out the correlation between my mouth, my heart, and the food, how that food is assimilated in my mouth and what it does. I guess the most important thing I'd like to share with people, Terry, I had to become proactive, learn about the disease, and stop allowing my dentist or periodontal people to do it for me. Come in twice a year, do this, do that, get your x-ray, clean your teeth. I did that, and it didn't work for me. So then I started really studying and learning about the mouth, about teeth, about the gums. And what we found out, the Surgeon General has declared oral health the #1 silent killer. It's not high blood pressure.
Really?
It's not diabetes, because those diseases are caused from poor oral health.
That's the starting point.
Yes. Now, I would like to clarify for people that are listening, poor oral health doesn't mean you don't brush your teeth. There are the extreme cases where you see people, their gums in their mouth are just absolutely disgusting and horrible. And yes, there are those stages. I was not one of them.
Well, you're saying that you brush twice a day and floss.
Yes.
You were doing all the things that we're told good kids do with their teeth.
That's what you learn from the American Dental Association. They also say that you should brush your teeth at least 2 minutes a day. The average person brushes 43 seconds.
I've got the little timer on
There
mine.
you go. My personal experience from my 45 years plus $225,000 later has been that you need to brush 1 minute per quadrant.
Double it.
That's it. Oh, I don't have time for that. Trust me. You'll find time. You're either going to pay now or you're going to pay later. When I would go to the dentist, first of all, I would get depressed knowing what they're going to find. I'm sure it's more pockets, more bleeding, more this, more abscess, whatever. I would be crying before I even got there. When you go in there and they do find something, it's thousands of dollars. I'm on a fixed income. I'm retired. My teeth almost took all my money. It would just be very depressing. And I would be crying and they'd be like, oh, what's wrong? I said, you don't understand. I want to have all of my teeth taken out. I can't take this anymore. Oh, well, you don't want to do that. They would always talk me out of it. And I didn't know why. Well, because, you lose your sense sense of taste and that wasn't it. For me, had I gone ahead, I had a few extractions. I think I've had like 7 or 8 extractions with this disease. But for me, what I found out was my healing process. When I heal, I produce bone spurs. So if I wanted to have dentures, that's not an option because the bones are sticking out. So they go back in, they shave it down, and then something else pops up. The second thing is that gum disease is a degenerative disease. It's systemic. It's in your system, in your bloodstream, because it's a constant low-grade infection and inflammation of gum and bone.
The whole topic of inflammation is a huge issue.
It causes all diseases. Digestion starts in our mouth. Everything starts in our mouth. The component and the correlation, heart disease and gum disease, 90% of people who have heart disease, diabetes, high blood pressure, eczema, HIV, AIDS, Lou Gehrig's, and it goes on and on. There is a pathogenic or bacterial component, and it starts in your mouth.
What do you do?
Well, I've had divine intervention. I was exposed to a gentleman here in town through a local friend. They've known me for many years and known over the years how I've suffered. They had introduced me to a gentleman, and they said, here, give this guy a call. He has a company here in town. They make oral health care products. Maybe they can help you. I'm doing everything I'm supposed to do. How can this help me? But I'll give it a shot. So I gave him a call. It ended up being the president of the company, Robert Toctalian, owner of Vitamer, myrrh as in myrrh oil, international natural products here in Las Vegas. We started talking on the phone, and we started sharing periodontal gum disease stories. And when I think about it now, it makes me almost want to cry because we both were sharing such intimate, painful, depressing, because no one understands if they don't have the disease, go get your teeth cleaned. That's not the answer.
Well, not when you're doing everything you're supposed to be doing and you're still having issues.
Right. So we shared the story. Then we decided after that, we said, you know what? We have such a common passion to get this information out to people. We need to do something. I already had a radio show on another station, and I said, come on my show and we can start educating that way. Long story short, we joined forces. I became part of Vitamer. We moved my show over, and as you know, I'm a KDON gal.
That's right. That's right. AM 720 KDWN.
That's right.
I'm going to say Saturdays at 7 a.m. Is that right?
There you go.
Okay, I've been paying attention.
We joined forces and we started broadcasting and started teaching people about oral health. And I'm putting together some classes I'm going to be doing in the fall, working with Humana and United Healthcare to teach people. This disease, you cannot cure it, but you can certainly manage it very well. When I first started, my mouth ranges anywhere from 2 to 12 millimeter pockets. And now my mouth measures 2s and 3s. It's manageable. It's under control. I can brush my teeth now where my gums don't hurt. It was always painful. I can brush my teeth and they don't bleed. My teeth are not loose. I can bite into an apple and not worry about whether or not the tooth is going to be in there or not. It has changed my life. It's my new passion. I am as raw and as passionate about oral health as I was when I brought raw food to Las Vegas 13 years ago.
Chef Sharynne is our guest today on Talking Solutions. We are discussing oral health, how important it is, and how taking care of your mouth can help to be a preventative, something that will keep you from dealing with heart disease and so many other illnesses that can end your life, quite frankly.
Talking about the effect of gum disease, oral health on your life and your heart. October of 2015, I have one tooth that is an anchor tooth that has a bridge of 3 other teeth in the back for my molars because those have been pulled. It was starting to go bad. It had a 12 millimeter pocket, which means the crown to the root is about 15 to 16 millimeter. That means that my gum was all the way open. So every time I would eat, food would get in there. And then the saliva would start to do its thing, which it's supposed to do. Start with digestion with good bacteria, bad bacteria, but guess where the bad bacteria would go? In that pocket. And it would start the inflammation and then the infection. And it got to a point where it gets depressing. The inflammation, as you had talked about, is something that is throughout most of our bodies. Most of us have inflammation of some sort, whether it's arthritis, itis, meaning inflammation, or any other type of heart condition. High blood pressure is an inflammation of the blood vessels. So I'm trying to protect this tooth because of its positioning and holding of my other teeth. And I was told that I was going to lose this tooth. Now I'm freaking out because now that means I have to have 4 teeth somehow implanted. I am not a pro-implanting person because number 1, I know that it's systemic. I know it's in my system. Number 2, what's to keep this from attacking the titanium, stainless steel? I don't care what you use. And number 3, there is no guarantee that it's going to work. And number 4, I really don't believe in it. For me, I'm not speaking for other people. So what ended up happening was I went to 3 or 4 different dentists in the course of about a week to 10 days trying to get other opinions and consultations as to what else can I do. If I pull it, I have no chewing back there. If I don't do implant, what am I going to do? I can't do a bridge. What should I do? I had gone to the very last dentist, and I finished up around 3:30 in the afternoon. I had a meeting that evening, American Heart Association, around 5 o'clock. At 7:30, I'm in Centennial Hospital in the emergency room. I thought that I was having a heart attack. And what had happened was that pocket, that 12-millimeter pocket was broken, and the abscess spread throughout my system. And
Going
the first
into
place,
your bloodstream.
Exactly. And through your bloodstream, the first place it goes to is your heart. My blood pressure, I'm not hypertensive. I don't have high blood pressure. 182/120. That should have killed me alone. And then I had what's called AFib, or afibrillation. My heart was beating irregularly, and tachycardia, beats of about 160 beats a minute. I couldn't even breathe. And so my husband takes me to the hospital. I get there, and now starts the fight. You're having a heart attack. I'm not having a heart attack. I have stage 4 periodontal. I've had an abscess, I believe, that has been broken. I have a septicemia. No, you're having a heart. I had to argue and fuss and fight because there were certain tests that they wanted to do. And I understand the liability from a standpoint of the hospital, but listen to your patient. Your patient is talking to you as another healthcare professional. I wasn't talking to you off my head and didn't know what I was talking about. I'm giving you specific information about what happened and what has happened, and you're not listening to me. Long story short, I'm saying all that to say, if you do not take care of your mouth will take care of you.
Not in a good way.
Exactly. It will kill you. So I came home and I really became very, very proactive. I started studying about the mouth. I started studying about the teeth, about the gums, about the bone. And I learned that my mouth is only one cell layer deep. Not like your skin. You got dermis, epidermis, okay, you've got all your different layers. Your mouth isn't like that. It's only one layer. What did that tell me? That I can absorb quickly. So like if you do B12 and they tell you to go sublingual under your tongue. Why? Fast absorption.
Exactly.
There you go. It's only one cell. So I said, wow, one cell. So that means that maybe I could get things into my mouth if I soaked. Then I start thinking, well, what can I soak with? There's hydrogen peroxide. I did that for a while. And I did other things. And I started using other combinations. And my dentist gave me something, and I don't mean to badmouth this medication, but I'm going to say it anyway because millions of people are probably using it and don't know. It's chlorhexidine gluconate, and it's an oral rinse by prescription, usually by your dentist, oral mouthwash that's antibacterial, but it's chemically antibacterial. When you open up the label and you see the C and the H and the O and the atoms, and I said, oh my God, what am I going to do? So I'm using it. Then I went to see my naturopathic dentist, and he asked me, so what have you been doing to your mouth? Well, I've been doing peroxide and chlorhexidine. And he said, well, how many times are you using it? I said, 3 times a day, every day. Oh, well, that's not good. That'll give you liver failure.
You process everything through your liver.
Yes. So then I said to myself, did my dentist not know that? Or did he know it and didn't think it was a big deal? So I'm saying all that to say, again, just because they give you a certain protocol, it doesn't mean they're right. I may have gotten rid of the bacteria, but 20 years from now, I may end up with liver failure. But I don't drink, right? So you're trying to figure out where could that have come from? And it could have been something as simple as the fact of me trying to control the bacteria in my mouth. I poisoned my liver.
A lot of people who pass away from liver cancer, it has nothing to do with the drinking issue.
Not nowadays. Back in the day, it did because we didn't have all these prescription drugs. But trust me, anything that you're taking, it all goes through your liver.
Yep, you process everything that way, which is why I don't want to take a bunch of stuff.
Exactly.
So what do we give people as an approach to make sure that their oral health is the best it can possibly be so that they can hopefully be able to avoid all of these other health issues, including heart disease, which once again has been stated as the #1 killer of Americans?
Follow the money. I plan to make the American Ortho, I don't even know what their organization is yet, but I will find out. I intend to make that my #1 cause because if I control your mouth, I can control your heart.
You can hit it a stage earlier.
Yes. And not only that, think about it. If we're not taking care of our teeth at a young age, are we not setting ourselves up for heart disease later on?
I think that's very true. And I don't believe a lot of people are aware.
No, they're not.
They're just thinking that it's a disciplinary thing. We need to get the kids to brush their teeth. That's something important for them to learn. I know that we have done some public service campaigns about children's oral health, but it is critically important for all of us to have optimal oral health.
When you ask me about suggestions, these are very simple things that people can do. I would like to recommend that you use Vitamer because that has been my success story. And those of you that are listening that know me, you know that I'm not out here selling products. That's not what I do and never have and never will. However, if you find something that works on a disease that could kill you, wouldn't you want to share it?
I think I'd be telling people.
All right. So for starters, for me in the morning, I do a warm glass of warm water just to kind of swish around, #1, to open up those pores, of which you only have 1 layer. And then I will use Vitamer Herbal Mouthwash, which only has 5 ingredients. ingredients, all of which you can pronounce: distilled water, zinc, myrrh oil, clove oil, and folic acid. I swish with that, and then I spit it out. Then I will brush with the toothpaste. We have 2 different types of toothpaste, actually 3, one for children. Then I'll rinse again, and then I'll use my tongue cleaner. Critical, critical, critical. You can brush your teeth all you want. You can use all the flossing and the picks, and it doesn't mean a cotton picking thing, because the vast majority of those bacteria are produced when you are sleeping. When the tongue rests up against the palate and it's nice and dark and warm in there, that's why when you wake up, your breath is kicking.
There you go.
Oh, exactly, because of the bacteria. Rinse, brush, and then I rinse again. Then I take a tongue cleaner.
Right. I've seen those before.
Either copper or stainless steel is my first choice for everyone, not necessarily the plastic. And you will start to clean your tongue. You'll go about 12 to 20 strokes in the middle, and then move your tongue to the side and catch the sides, and then on the other side. And this icky, nasty looking, creamy, yellow, yucky, slimy stuff will come off your tongue. It is disgusting, but guess what it's full of? Bacteria. Do that 3 or 4 times. Now, when I did the experiment on myself, after your mouth is 100%, you've cleaned it, brushed it, flossed it, you've done everything you possibly can, right? Drink a little bit of water, go back in the bathroom, and use your tongue cleaner, and guess what? It starts all over again. Because digestion starts in your mouth. It's the enzymes in the saliva that even react with water. I didn't know that.
So we should just stay at home and clean our tongue all day.
Either that or stop eating. I tell people, ideally you want to brush after every meal. And once you start becoming more conscious of your mouth and your teeth, you really will start to think about, do I really want that cookie or whatever? Because now I got to go brush my teeth. I think I'll wait. And that's what starts to happen. At first it's hard because I don't want to brush, but just try. It'll work. Learn to incorporate it into what you do. When I wake up in the morning, first thing, warm water. I'm swishing on the way to the kitchen to start the coffee. When I come back, I spit it out. Then I do the mouthwash. While I'm doing that, I'm making up my bed. I'm swishing while I'm doing my bed. I'm killing bacteria before I even start the brushing process. So I'm swishing, I made up my bed, I come back, I spit out, now I brush. I've done 3 things already. And I've taken care of mouth. It's not difficult.
Multitasking.
It is. And just learning to incorporate it, it becomes part of your DNA. Just like washing the armpits or washing the 3 most important spots if you don't have time to take a shower. You just know you do that and you're good to go. It becomes part of your lifestyle. But the biggest problem I find, Harry, is that the basic knowledge and education is not there. And people say, well, I think the parents should teach them. The parents, listen, we just said more than 80% of the population has gum disease, so how in the hell are they going to teach kids?
The parents
they don't even know
either.
Their breath is smelling. So a little tip for people how you can check people out is check their breath in the morning. Seriously, children, we're seeing them as young as 3. If you're smelling that breath, that means there's bacteria in there. If there's bacteria, there could be abscesses under the gum.
So bad breath is not really supposed to be there?
Never. Although they make a lot of money off of it because it's a joke. Oh, you have bad breath. You need such and such a mouthwash. But what they're not telling you is that bad breath is a sign that you have periodontal or gum disease. Scary, isn't it?
I'm just thinking of how much Listerine my husband buys.
Yes. Let's talk about products in general. The vast majority of products on the market today have agents in them that will kill the bacteria and they will kill the breath. They also will destroy the tissues of your gum. Now, we just learned that the tissue of the gum has how many layers?
1 layer.
Where does all that stuff go? Have you ever read the ingredients on that label?
There's a lot of stuff you can't pronounce.
That's right. And all that stuff goes in your, and we also learned that it also ends up where? In your liver.
Mm-hmm.
So again, over a long haul, God forbid, 10, 20, 30 years from now, you could be diagnosed with a liver cancer and never have a clue where it could have possibly come from. It could have come from your mouthwash or your toothpaste or whatever you're using that you're absorbing.
It sounds to me like we all need to resolve to take some preventative, protective steps in our oral health to help solve all kinds of future issues.
It's a matter of life and death.
It also leads in many cases to heart issues, as we've discussed. Chef Sharynne is with us today. Flavors of the Heart is coming up at the World Market Center. I went a couple or 3 years ago. Loved that event. You're involved with that, aren't you?
I am. This year I'm going to play social media butterfly. I've been honing out my videoing skills. Because I'm getting a little older this year, I'm not going to be participating as a chef. I'm going to be doing the social media stuff. So I decided I'm going to go in like on Friday. I'm going to videotape all that goes on behind the scenes before our guests come on Saturday, September 17th at the World Market Center. We're going to be videotaping as everyone's bringing in their food and their cooking. We're going to be in the kitchen when the guys come in and set up the tables and the flowers and everything. So you'll get a chance to see what goes on behind the scenes. This event is very dear to my heart, no pun intended, because it really helped me to get my message out to the community and still be able to support a national program from the American Heart Association. We have a great group of chefs this year. It should be a lot of fun, and I'm really looking forward to it. So there won't be any raw food this year that I'm aware of, but that's okay.
They have a lot of offerings. It's wonderful. You just go and you nosh and you try all these different foods, and you meet all these local chefs and restaurants who have wonderful, healthy options, and it's all benefiting the American Heart Association. Chef Sharynne mentioned that it's coming up on Saturday, September 17th at the World Market Center. That place is amazing.
Is that
awesome? Was my first visit to World Market Center.
Awesome. 16th floor with a view of the city, and after a couple glasses of wine, the view is awesome.
It's beautiful up there. It really is a lot of fun, and it's just a great event. A lot of great food. You get these goodie bags that are wonderful for being a part, and I do understand that tickets will go on sale on July 15th.
That's correct.
We'll make sure that the links and all the stuff you need to know are also included on our Talking Solutions Facebook page, along with a podcast of our discussion today.
And real quick, I'd like to share about the American Heart Association Flavors of the Heart. We've been working on a program going into our 6th year now, Teens Cook with Heart. This is a program that's part of the American Heart Association and also part of Flavors of the Heart, where we go into the Clark County School District. We've now been approved through the Department of Education in the state of Nevada for any schools in the Clark County School District that have a culinary program. You are eligible to participate in Teens Cook with Heart Next Generation. We had our first state champion last year, Titi Aguilar. We have another champion. I can't mention her name yet, but this program also benefits Teens Cook with Heart. And it is a program that, as most people know, there's not a lot of support in homes for kids today, particularly our teenage kids, and particularly the girls, and even the boys. They don't know the difference between a zucchini and a cucumber. I mean, it's sad, but it takes them through the entire course. It teaches them leadership and how to depend upon one another and how to help and how to educate and how to communicate and how to overcome fears and how to be creative. Tools that they're going to need when they get out in the real world, whether they become culinary people or not. It has taken us 5 years. We're now in our beginning of our 6th year, but we are now available throughout the entire state of Nevada. And I would recommend, if you have young people in your family that kind of love hanging out in the kitchen, let them take the program, because when they finish, they come out young men and young women. It's a wonderful program. The winners will be at Flavors of the Heart.
This sounds great. One of my favorite shows is Master Chef Junior. I love it when kids get interested in preparing food.
And one other thing, make sure when you come, wear elastic waist. What I try to tell people, really, is try to be light on what you're eating during the day, because not really pigging out. If you sample a little bit of everyone's, you will be full.
Just come hungry.
We have coffee. We're going to have wines. We've got our French chocolatier. Just everything. Nobu is going to be there. All kinds of things. And Chef Carla Pellegrino is going to be there.
Ooh.
Yay! I know. We're really, really excited. It should be a very fun year. Come see us.
It's a great event. Saturday, September 17th at the World Market Center. Tickets on sale July 15th. All the links on our Talking Solutions Facebook page. If we could just have everyone have great oral health.
That's it.
We would have major changes in the health of this country all the way around.
And I truly believe that if we had control of it, that a lot of the diseases that we're seeing today, we would not be seeing.
It sounds kind of simple, actually.
It does. But if, again, like you and I have always talked, if you do not give people the knowledge, my people die from lack of knowledge, you never are going to overcome. These are things that should be taught in the school. It should be mandatory that we teach about oral health and how to take care of our teeth. We teach basketball and ballerina and everything else, but the most important things that can make a difference in a child's life growing up, because you're sentencing this child to a life of periodontal disease.
I vote that we put you in charge. Yeah. We'll get you in charge of this program for like the Clark County schools.
I would love that.
We could start here.
I would love that. I would love that.
Okay.
Hook up with the Ronald McDonald people, because I know they've got a mobile unit, too, that they operate here in the state of Nevada.
Yes, I've seen that.
Yes, that would be wonderful. That would probably, if I left this earth tomorrow, or let me get involved in it first, and then after that, left this earth, that would be probably the most rewarding thing in the world for me.
You never know what's going to happen.
You never do.
Well, sharing knowledge is very important in raising awareness on the importance of oral health, leading to heart health, the American Heart Association, Flavors of the Heart, the event in September at World Market Center. All of it exciting, and thank you so much, Chef Sharynne, for coming in to share it with us on Talking Solutions.
Thank you, Terry.
How about a PSA?
How about one?
Here's what I would love, darling.
All right.
If you could, and it's just free form like everything else. That's how I do stuff. If you would just introduce yourself and invite people to come join you or join everyone at Flavors of the Heart, and if we can just give them somewhere to go as far as a website or something to get tickets or find out more information.
Sure.
I'll put it on.
All right.
Have at it. My microphone's off.